Well, thank you very much, all three, for attending the UK MDS Forum Education Day and for accepting to be interviewed. So can I just ask you in turns to state your name, which hospital you work for, and the title of your talk?
So my name is Sophie Laird and I'm a clinical scientist at the Wessex Regional Genetics Laboratory in Salisbury. And the talk that was presented today was the outcomes of an audit looking at the clinical utility of the myeloid next generation sequencing panel.
Thank you. And Sally?
So my name is Sally Killick. I'm a haematologist at Bournemouth Hospital, and I've been working with Nick and Sophie on the audit looking at the utilisation of the Myeloid Gene Panel.
I'm Nick Ross. I'm Professor of Human Genetics at the University of Southampton and Director of the Wessex Regional Genetics Laboratory in Salisbury, where we've been running the Myeloid Gene Panel.
Thank you so much. So may I start with you, Sally, and can you tell us a little bit why you conducted this particular audit?
So thank you, yes. So as a clinician, new tests come on board to help us both with the diagnosis and prognosis of patients with MDS. And the Myeloid Gene Panel is a new test. So Nick and myself had a conversation 2 or 3 years ago now about setting up the Myeloid Gene Panel to help local patients in Dorset and Wessex. So once we'd decided that this would be a benefit to our local patients, we then thought it would be useful to find out how clinicians in the local area were using the test, were they requesting the tests, and how were they using the results. And that's how we set up the audit.
Great, thank you. And Sophie, can I turn to you and ask what you found in your audit?
So we found that generally clinicians were finding the myeloid panel very useful. In particular, they found it useful in patients where helping in the diagnosis of MDS and also helping identify markers that might help decide what the prognosis was in those patients as well. We also found a number of individuals where the myeloid panel results allowed for avoidance of a bone marrow procedure to have been taken. So overall, a positive result, a positive response about how the myeloid panel is being implemented into the patient pathway.
Brilliant. Nick, can I turn to you? And can you tell me more about the confidence of results using blood samples versus a bone marrow biopsy?
Mm-hmm. So there are lots of technical considerations. This is a very highly complex test. But it can be done on blood or bone marrow. We're still learning the differences. When we've had several patients, we've had samples from both, and the results have been identical, and others we've seen small differences. What we generally recommend at the moment is if a patient is having a bone marrow, then we would prefer to analyse bone marrow, but we get a lot of information from peripheral blood, and indeed most of the samples we've had have been from peripheral blood.
Okay, thank you very much. Nick, may I ask you a basic question? What is a myeloid gene panel, and why do scientists and clinicians run such tests on some patients, please?
So we know that MDS is a very complex disorder, but like all different types of these disorders, they're fundamentally driven by abnormalities of genes that are required during the lifetime of an individual. And what we're looking for is a large number of genes that we know are involved in MDS to see whether there are specific mutations, so changes in these genes that may actually be driving MDS. Finding these can increase the confidence that this is really a diagnosis of MDS. We also know that some particular genes are associated with a better or a worse prognosis, and that may then indicate specific types of treatment.
Thank you very much.